Welcome back to the Kiosk Presents. My guests today are Dr. Michael Weitz, lung cancer patient and a member of the Lung Cancer Foundation of America's Scientific Advisory Board, and Dr. David Carbone, lung cancer specialist at Ohio State University. Gentlemen, welcome to the Kiosk Presents.
Thank you.
Thank you for having us.
Dr. Carbone, how does molecular testing in lung cancer work?
Well, it looks at the tumor sample resected from the patient as in the form of a biopsy, and the DNA in the tumor from that each patient is analyzed for the presence of target genetic abnormalities that we call driver gene abnormalities that can be paired with specific therapies to turn off that switch and result in dramatic shrinkage of cancer, improvement of symptoms, and prolongation of survival if that kind of matching can be made for that patient.
So how can a lung cancer patient tell if they're a candidate for this testing?
Right now, most non-small cell lung cancer patients have a chance of having such abnormalities. The most common type of lung cancer is non-small cell lung cancer, about 80% of cases. And the most common subset of those is called adenocarcinoma. And I think every adenocarcinoma for sure should have genetic testing. And probably we are working toward a point where every non-small cell lung cancer should also be tested. So basically a patient with lung cancer should ask their physician to get genetic testing done in most cases.
Now, what are some of the outcomes with this testing? Have you been seeing really good, you're saying that they can be reduced. What are some of the outcomes that you're seeing with this testing?
These results can be dramatic. We're not talking about prolonging life for 6 weeks at the expense of a highly toxic therapy. Mm-hmm. If a match can be found between a patient's tumor mutation and a particular drug, I have seen patients literally days or weeks from death have their tumors shrink completely away and return to a normal quality of life for years with the proper pairing of a drug and the genetic testing. So this is not a subtle effect. This is not a small prolongation of life. The average lung cancer patient survival, if you don't have a targeted therapy, is 6 to 12 months, depending upon other factors. I've had many patients live years or even more than a decade with these kinds of targeted therapies. And Dr. Weitz is now a 7-year survivor because of this genetically targeted therapy. And maybe he should explain his story.
Well, yes, Dr. Weitz, congratulations on being 7 years cancer-free. Can you tell us a little bit about your journey with lung cancer and with the molecular testing?
Sure. I was diagnosed 7 years ago and had, I was stage 3, almost stage 4, and which is the worst. And I had traditional chemotherapy, I had radiation, I had my whole left lung removed, and then I had spread to my bones and I had spread to my brain, and I was beginning to run out of options, and discovered, my mom discovered on a television program, the nightly news, a gentleman who had was on his deathbed basically, and had his last hope was this targeted therapy. He went on it and had dramatic reduction and went from his deathbed to living a quality life. So I went to my oncologist and had him test for this mutation as well. Fortunately enough, I had the mutation and I had a very similar response to the person that my mom saw on the news. I had a 2/3 reduction of my tumor within 8 weeks, and my tumor continued to melt away. Now I have no active disease, and this is all on the basis of taking a pill twice a day with limited side effects. So, you know, in the beginning with chemotherapy, you get all the toxic side effects because chemotherapy affects all cells in the body, not just the cancer cells. Targeted therapies target the cancer tissue itself. So the side effects are quite limited. And for me, I have basically no side effects. So it's been a real game changer for me. And I think that, I think that there's hope now has been restored in lung cancer where nothing happened for 40 some odd years. Now we're starting to get long-term survivors. And I think that brings hope to patients, that they know that you can survive stage 4, that you can live a long life, you can live a productive life having stage 4 cancer. And I think, but every cancer needs to be tested, even from my standpoint, from stage 1, 2, 3, 4, because there can be recurrences and you need to know what you're dealing with. Knowledge is power when it comes to lung cancer, and just don't give up hope. Don't let anyone take away your hope, because there are exciting discoveries that are yet to come, and it's going at a accelerated pace now. And so I think there's lots of reason to hope to take what was a fatal disease into what now is clearly a manageable disease.
Wow, well, it's really encouraging to hear these new precision medicine techniques coming out to help lung cancer patients. Dr. Weitz and Dr. Carbone, thank you so much for joining us here on the Kiosk Presents in Buffalo and Western New York.
Well, thank you for having us.
Thank you.